Hi, it's Dr. Murphy. So today we're going to talk about obesity. So first we'll define what obesity is, then we'll talk about some of the effective treatments like the GLP-1 agonists, and then lastly we'll talk about how to minimize the side effects of those medicines so that you can tolerate them longer. So, obesity is the medical term we use whenever your body mass index is 30 or higher. And the way we determine that is by measuring your weight, measuring your height, and then we put it in the calculator and it tells us what your BMI is. And so, if you have a BMI of 30 or greater, that is obese. If you have a BMI of 25 to 29.9, that's overweight. And those are the two classifications that we need to be able to prescribe weight loss medications. And so that's the importance of getting the accurate diagnosis. So GLP-1 agonists, everyone's talking about it now. The most popular is Ozempic. Then there's others like Mounjaro, there's Trulicity, and so on. So the reason they're talked about so much is because they work really, really well. But we don't prescribe them for everybody, so we'll talk about who's a good candidate for the medicine and who's not. So typically, once you come in and you tell us you're struggling with weight loss on your own, we want to talk about what you have tried already and what has worked, what has not worked. So mostly focusing on nutrition, like have you reduced your calories? Have you done special diets? If so, what worked well, what didn't? Are you keeping a food log? That's really important so that you know what nutrients you're getting, how many calories you're getting, and we can adjust based on what your weight loss goals are. And then aside from nutrition, of course, we'll talk about your physical activity. Are you sedentary and don't move around much, or are you really active and getting your exercise in daily? Exercise don't usually produce as much weight loss as nutrition changes, but it still is very important. So we will talk about that as well. So if you're someone who's not able to achieve your weight loss goals with eating healthier and exercise, that's usually when we talk about introducing medications. And for several years, we've had experience with GLP-1s now. We know that they're pretty safe. There are side effects like there are with other medicines. So we're going to talk more about that here shortly. But before we get into that part, I do want to remind you all to make sure you go and like and subscribe to my page so that we can keep growing and providing you with good information. So GLP-1 agonists are used to treat multiple conditions. So obesity is one, but it's also used for things like diabetes, obstructive sleep apnea, and they've been able to find some cardiac and kidney benefits from this class of medication. So it's very useful right now for health in general. So what it does is it activates the GLP-1 hormone that slows down how your food is empty, you feel full faster, it regulates your insulin release after you've eaten. So it really just helps control how much food you're eating. And then when you get full, when you feel full quicker, you stop eating. So it reduces the amount of calories that you have. It helps with that. And so the side effects that you typically get are GI related, which makes sense based on how it works. You get nausea, diarrhea, constipation sometimes, vomiting. You really have to be careful with that because if it's really excessive, you may get dehydrated. And so you do want to make sure you're drinking plenty of fluids while you're on this class of medication. But those are the most common side effects. There are some rare things that we've seen reported, such as retinopathy or blurry vision. Some people insinuated some mood changes, but studies aren't consistent showing that it does increase mood disorders or suicide risk. So that they're still investigating. But the most common, like I said, is the GI side effects. And for patients who have a history of medullary thyroid cancer, MEN, which is different neoplasias, pancreatitis, or gastroparesis. We will not prescribe the medication for you. That is a contraindication. So there's some patients who will not qualify, but most people do. And so if you do qualify, the biggest thing we want to do is make sure that we dose appropriately to minimize the side effects. So we'll prescribe the medicine at the lowest dose first and let you take that for at least a month before we look at titrating up the dose. And there are some of the GLP-1 agonists that you can inject weekly. There's some that you inject daily, and we do have the oral pill options now as well. And so we'll start you low, take that dose for a month, and then we'll bring you back, see how you're doing. Are you having any side effects? Measure your weight, see how much you've lost. Typically, our goal is to get at least 5% weight loss. And then from there, we can determine if more is desired or not, and if we need to titrate the dose up or not. So there's at least 3 or 4 levels of dosing for each of these medicines. And the goal is to not get to the maximum. The goal is to get your weight loss goal. So we don't want to focus on getting you to the max dose. We want to stop at the dose that is the most effective for you and that is not causing severe side effects. And so I think that's how a lot of people get into trouble. They're just ramping up the doses too quickly, or just trying to get to the maximum doses so that they have the greatest weight loss. But just keep in mind, that's not the goal here. The goal is for us to get to a healthy weight so that we are able to reduce those risks of obesity, which is high blood pressure, diabetes, heart disease, stroke. Those are the things that we're trying to prevent, sleep apnea. So all of those things, once we lose the weight, we have less risk of getting that. So that's the importance of weight loss in the beginning. So that's just an overview of obesity and how we can use GLP-1s to reach our weight loss goals and to overall improve our health. So if you have any questions about that, please leave a comment and I will respond. Thank you.